Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go over some knee stretches. So you can feel stiffness in your knee when you're walking, when you're sitting, and it's a great time to loosen up your knee. So what happens at the knee, unfortunately, can be coming from the hip or from the ankle. So it's not as simple as saying, here's a couple stretches that'll just happen at the knee. You have to worry about loosening up all of these muscles. And that's the important part, is if you only try and hit one, you're not going to be able to loosen everything up. So if something is tight in your back, it can even affect your knee. So you want to make sure that you are loosening up all of your muscles and not just the one specific at your knee. But we are going to show you a couple of stretches that may appear to be at the hip, but are truly going to affect the knee, because all of these muscles come from the hip or come from the ankle and actually attach at the knee and can be causing some knee tightness. The first one we're going to do is just a quad stretch. So you're going to just grab your leg. Now you can hold on to something and you're just going to pull it back nice and easy. So I'm going to show you from the side, and you're just going to hold on. Now you can pull your leg back. What you don't want to do is arch your back really a lot, because you don't want this to affect your back. So if you cannot hold your foot like this, you can actually put it on a table behind you to get that stretch. But if you can, just grab your ankle and hold. You should feel a gentle stretch through the front of your leg, maybe even into your hip flexor. But that's the first stretch you want to do. You want to hold that 30 seconds, and you want to do about 6 of those. The next is a hamstring stretch. So there's a couple ways you can do a hamstring stretch. You can do it sitting, you can do it standing. I'm going to show you standing, but this is going to stretch the back of the leg. So all you want to do is start with your legs straight, bring your toes up. You're going to bend the opposite knee, keep your back straight, and bend forward at the hips. What is commonly done wrong in a hamstring stretch is this, where you round your back, you round your spine, and then you reach down and you grab your toe. That's not going to do anything except actually hurt your low back. So you want it nice and straight, and you're just going to hinge forward at the hip, and then you should feel a stretch going all the way down the back of your leg, probably even into your calf. You can do that also sitting down. Same rule applies when you're sitting down. You don't want to lean all the way forward, break that back, put a curve in that spine. You want to make sure that leg is nice and straight. And then the final thing, the final stretch is a calf stretch. So you can do this up against the wall. I'm going to show you from the side. Front leg is bent, back leg is straight with your heel down, and all you're going to do is just lunge forward in this leg until you feel a stretch in the back of your calf. So back here. You want to make sure that your toes are pointing forward, and you want to make sure that this heel in the back is on the ground. If this heel starts to come up, you're not going to feel any stretch. So you want to put your heel down, and again, you should feel stretch into the back of the knee. You can also do this one where you put your toes on a step and drop it down. There's a couple of different stretches that you can, or a couple of different variations on the stretches that I showed you. You want to hold each of those 30 seconds about 6 times. That'll help you loosen up your knee. Doing it once here or there for a couple seconds isn't going to do a whole lot. So make sure you have that time to at least invest in one of the stretches before you start doing it. But those are just some simple knee stretches. Again, there's a lot of muscles on the inside of the hip, the outside of the hip, the front of the leg, that come up and attach at the knee and surround the knee. So if one of them is tight, it could be pulling on others. I only showed you 3 quick ones that you can do just to kind of start hitting some of the major muscle groups, but there's others in there that you may need to hit in order to loosen everything up. If you or someone you know is suffering with knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good day.